Good afternoon, everybody. I'm Sonia from Rural Health West, the Practice and Business Support Coordinator, and thank you for joining us for the RACGP Quality Improvement and Continuing Professional Development Programme, the 2017 to 2019 Triennium requirements. We're lucky today to have Sharon from the RACGP present this for us. Just a few housekeeping situations. At the moment you're all muted, that's to reduce the background noise. Now the audio options, you can either use your telephone or your computer speakers, and there's also a chat box or questions and follow-up, and please don't hesitate to write in there the chat box or questions if you've got anything that you'd like to ask Sharon in between time. So without further ado, I will hand you over to Sharon.
So welcome to the new Triennium presentation. This is my name's Sharon and I'm from the RACGP WA branch, and I'm here to help you out with any of your questions and queries about the new Triennium and what the types of activities that you are able to do to meet your QI&CPD requirements. What we'll be covering today is the new, as I said, the new QI&CPD requirements for this new Triennium. We're going to go into a bit more detail about plan, which is one of the new activities that are required, and how that can be used to structure your learning. Also, how can your GP practice support you in the requirements, and what different types of activities can you actually do within your practice with your fellow GPs? And finally, we'll look at the GP credit point statements and how they can be used, how to access them and what they can be used for. So just to let you know as well, we'll take a break in the middle of the session just to answer questions. The break will be after the information about plan and before the other types of activities that you'll be able to do within your practice. So just to start, just a bit of an overview about what the Continuing Professional Development and Lifelong Learning for GPs is. What it is a program that supports general practitioners to maintain and improve their knowledge and skills to provide the best possible care for patients and their communities. It includes a range of activities to meet individual learning that is relevant to their scope of practice. And that's what you'll see today. There is a significant range of different types of activities to meet your needs. There is that normal Cat 1 activities, which are those longer activities that have a 6-hour minimum. There's also Cat 2 activities as well, but we'll go through a range of what they are. The QI&CPD program has been developed by RACGP WA RACGP to provide GPs with opportunities to improve patient safety and quality outcomes, to support continuous quality improvement within the general practice setting, and to enable GPs to fulfil their individual and vocational continuing professional development. So they're the overall objectives of the program. One of the questions we get regularly is, who has a requirement? So who is required to be part of a QI&CPD program? The answer to the question is that Medicare requires all GPs who access any Medicare program or services, which are listed, you can see on your slide as well, to participate and complete those requirements of a recognised CPD program. Those programs that require CPD include the VR list, which is vocational registration, the Fellows list, the Workforce Medicare Plus, the MOPS program, and other specific interest activities as well, such as medical acupuncture. So it is a requirement of every GP that's vocationally registered or VR registered to be part of this program. There are some changes to the program for 2017 to 19 training, which we're just at the beginning of now, that ends at the beginning of 2019. In terms of what the differences are between last training and this, there's not many. The points total is the same. So you are required to have 130 points. Those 130 points can be made up of a variety of things, but there is some requirements within that are compulsory. One of those compulsory requirements is CPR, so everyone requires to do at least one CPR for the Triennium. That's not to say they can't do more than one CPR, but there is a minimum requirement of one. One Category 1 activity is also another requirement, and then there is a new plan activity that is a compulsory requirement as well. Plan is a Category 1 activity, and it is also the QI activity. So we'll go into plan a bit more detail because it is a brand new thing that RACGP has introduced into this QI&CPD program for this Triennium. What you can see on the screen now is an overall list of the different types of activities. We don't need to go through all of those, but I will be going into some in more detail later on in the session today. Specifically those that you can do within your practices and can do with your GPs, with your practice team, and even some other allied health professionals. So there's a variety of different ways that within your practice you can help meet your QI and CPD requirements. And as I said, we'll go through some of those in more detail later. So what's new in this particular triennium is plan, and that's what we're going to cover now. What is plan? Plan has been developed, and it's been in development for the last probably 8 years by the RACGP, and it's been developed to assist you in structuring your learning and needs. It provides evidence and documentation and allows you to map out information in your learning for the next 3 years. It includes information on your practice presentations. So who are the people that are coming in that you're seeing within your practice? The demographics of the practice and the patients that you see. What are your community needs? So what that sort of entails is, where are you? Where is your community, and how is that different from other GPs in different physical locations as well? And also, what are your personal aspirations for the triennium? So it covers lots of different aspects of all the different people that you see in your practice. So Plan, as I said, it's a comprehensive learning tool, and it does support GPs. What it does do as well, though, it's not just for GPs that are in general practice. It also covers those that are not in current general practice, that are academic, educational. It asks questions and puts it contextually to whether you're full-time or part-time, or taking any type of leave. Just a quick reminder, lots of the calls that we're getting are about how it saves and what it does. Within Plan, which you'll see in a minute, every single time that you click next, it saves that section. So just make sure that you're clicking next, and then it will save what you're doing. So it will be in your draft section within your CPD section of the RACGP website. So where is it and what does it look like? We'll just go through some basics at the moment. You can see under My CPD on the RACGP website, you'll see quite clearly highlighted with the red circle that it says Plan Activity. So when you go in there and you click on Plan Activity, it takes you to your plan activity, which is specific to you. The front page, I'm not going to go through all the detail. You do get a welcome page. There is 5 different elements to Plan that need to be done, and those elements need to be done prior to the end of the triennium. They don't need to be all done to start with. Really, the focus in the beginning is stage 1, which is to complete the questions related to your practice profile and self-reflection. And they are linked to the RACGP curriculum and competency program. What that does as well, though, it produces a report for you. So we'll go through the process and the steps for Plan. This is what Plan might look like in the very beginning when you first log in. As you can see, there's 6 steps. It gives you very clear indication of which one you are actually in and which ones you haven't got to yet. You have to do it stage by stage. You can't skip ahead. And as you can see, the ones that you aren't up to yet, it is not available and you're not able to access that information. But you can go into the one you're in progress in, and it gives you guidance if you would like some additional information about how that works. Once you've finished an activity and part of Plan, you can see this is what the screen will look like when you would next go into it. We can see this particular one, the practice profile and self-assessment is complete. So they've done the questionnaire. They've also gone and done their development plan, and that's complete. They've prioritised their learning areas, that's complete. So they know what their plan is for the next this triennium and what education areas they're going to focus on. This person as well has actually gone to step 4, which we probably wouldn't expect people to do within the next 6 months. But that would be, when you get to that, you'd be identifying the learning areas and you'd be completing those education activities that you had in your plan. Then you would do step 5, which is your overall reflection. Quality improvement in the plan activity is all about reflecting on your practice and your patients and what you're doing. So what this does is, once you've done Plan, you then reflect on how did that go, what did that mean to you. You might have changed some activities, you might have moved practice, you might have seen a different type of patient mix, and you might decide that some different activities meet your needs more than others do. So for that reason, you might actually change what you're doing. That reflection area is where you would put information about that. and then at the end you would submit your plan. When you submit plan, that is where you see the 40 points and the QI points come through into your QI&CPD statement. You will not see it in there until then, until that last section is complete. But you do have 3 years to complete this, or nearly 2.5. So it's just a matter of going through and doing those stages step by step. The very beginning stage, I'm just going to go through a couple of screenshots of what plan actually looks like, is asking the question whether you are a new fellow or you're continuing with your QI&CPD, because we do want to differentiate what your learning needs are within those 2 different frameworks. There is some other helpful information on every page and every part of plan. The highlighted section is red. You can go to your plan dashboard to see where your status is up to. There's a help section, there's a further information section, frequently answered questions, user guide, feedback and references. What the references are, just for your information, if you're someone who's interested in finding out, well, where did we get this information from? What are the statistics about? You can click into references and it will let you know where all of the plan information and criteria have come from. The user guide and frequently answered questions are exactly that, and they are very helpful. If you have any other questions though, the RACGP team, QI&CPD team are here to help you. The next lot of questions is because we really do want to differentiate between different GPs and their different needs, is to look at whether you're active in clinical practice and not active in clinical practice, whether you're in admin, medical education, academia, and on leave. And there's a room for other in documentation. So we do like that information filled in, because then we can get a snapshot of what your needs are. So plan activity is part of it, as I said before, is self-reflection. So it's understanding and identifying your own knowledge and skills. There is a rating system that is used within plan. The rating system is 3 different levels, and you're rating your confidence level against the areas that you're using. The rating levels are high, medium or low. And as you go through, you'll start to get a feel for which areas you might feel your knowledge and skills are above what is required, or potentially that you would like to increase your confidence in those areas of your practice. When you've done the questions, and there's approximately about 50 questions that make up the practice profile and also your individual levels, you get to choose. You see a report. It's a very comprehensive report, and there's lots of different matrices and filters that you can use to produce your report. It selects your learning needs. Now, you may choose learning needs from the areas that you've identified as low. You may also use learning needs that you've identified as high, because there might be some areas that you specialise in. Those are the areas that you may want to maintain, that areas of specialty, whilst also bringing up some of those areas of low. The great thing about the new plan program is it's directly linked to the RACGP education activities and also our provider activities. So if you check an activity, for instance, and one of your priority areas is men's health, and you'll be able to click on a link and it will show you all the activities that are accredited by RACGP and provider activities that are linked to that specific learning area. So it makes it easier for you to find activities and find what's going on. So they have linked that specifically to the activities. You would have normally found them on Find a Course or going to one of the faculty website pages within the RACGP, but now they're very easily found within that. You can go back and you can look, and it will update if you go in another 6 months, for instance, and it will show you the courses that have been updated in that particular learning area in that time. Of course, you can still go to Find a Course, and you can still go to faculty events to find courses as well. There's lots of different ways that you can do that. There is an optional area within plan that is called peer review. So you are able to automatically send your report, your plan, to a reviewer for someone to give feedback. The capabilities are all within plan, and it does automatically email your peer review report to that person, and it provides the opportunity when they send it back for you to upload, so you've got some data that's kept in there around that peer review. As I said, the peer review is actually optional. You do not have to do that section, but there is lots of value in doing that particular part of plan. So once we've done the process at the moment, where we're up to is we've done the questions, we've done our practice profile, we're seeing who's coming into our practice, we're seeing what are our areas that we've identified as an area to focus on for learning and needs. We have potentially done a peer review. The next step when you've done some activities is you go in and you complete and identify and complete the learning. You'll see here, here's one person where nothing's been uploaded yet. We do want to see some evidence within your specific learning areas that you've identified, and we'd also like some reflection on each of those learning areas, because as you'll see all the way through plan, reflection is a big part of the process for these quality improvement activities. If we go to the next stage, what you'll see is there is a direct link between plan and your already existing QI&CPD activities that you have done that have been uploaded either by RACGP or one of our accredited providers. So you can directly link those activities into plan as evidence to you've done some of those activities and they're linked to your learning needs. So that's a simple way of linking those to your point statement. Once you've done that, what you'll start to see is it's mapped more, you'll see the colours that, for instance, this particular person, their learning area number 1 was applied professional knowledge and skills. Their rating in that area was low. They've uploaded their evidence and they've done their reflection. The other ones you can see they've still got the evidence to do and they've still got their reflection to do. So all the way through it is very clear on what they're needing to do and what are the steps that are left to do before they finalise plan. So just to recap, we'll just go through that the new QI&CPD requirements for this 2017-19 triennium are that you need to do 130 points in total. That is the minimum requirement number of points. You'll need to do 1 plan quality improvement activity. You'll need to do 1 category 1 activity, and you'll also need to do 1 CPR course. And as I said, those are the minimum requirements. So I'm just going to break here. Does anyone have any questions that they'd like to type through that I can answer? Okay, I can't see any questions coming through. So what I might do is I might continue on to the next part of this. If anyone has any questions, please type them through. If you think of something after even, we're able to, you can email that through or message it through, and Rural Health West will send those through to me, or our contact details will be up at the end, and you can either call or email and we can assist you with those questions. So the next section that we will do is how can a practice support a GP with QI&CPD requirements? As I said, we've just gone through a lot of plan, but there is some particular questions at the very beginning of plan that are more linked to the practice profile rather than what your educational requirements are. Some of those profile questions might be information that GPs can get from their practice manager and that can come out of their practice software. One of those questions are around the hours of work for the week, the percentage of time that you're in the clinic or out of the clinic. This is just a summary of the information. One of the other questions is number of new patients for every 100 patients that you see. So some of those details might be able to be obtained through that practice software. Age groups, how many of each particular type of age group that you see as well, and also the demographics. So what are the nationalities and cultural backgrounds of those patients that are coming through? Because those sorts of questions and demographics and practice profile do impact what sort of education that you might be wanting to do throughout the triennium. So practice managers and practices could work together to provide information to GPs to complete the first part of plan, which is the more practice profile questions. So please talk to your practice and see how they might be able to help you with that. It's good sometimes to have that information before you start plan so that you can have some of it at hand and makes it easier to start. Some of the other things that you're able to do within the triennium and different types of activities, and I'm going to focus on 3 category 1 activity types here, and these are ones that you can actually do as a practice. So the first one is small group learning, and I'm sure lots of people have heard of small group learning. Small group learning as a definition within our college it's designed to maximise the benefits of working and learning together in small group educational settings. On a practical level, it's those meetings that you have monthly, they might be monthly, and you might have cases that you discuss that might be particular topics in education, people come along and talk. What small group learning does within this context is puts it into a framework and a template to meet the QI&CPD requirements. All of the activity and Category 1 activities are required to have a 6-hour minimum. Plan is more of an educational group session type of this. There's generally a cycle of meetings, attendance records, meeting summaries, learning outcomes, and at the very beginning even a plan around what is going to be taught and the theme potentially around that type of thing within your practice. So you might have a theme, for instance, of difficult, challenging cases or chronic disease, something like that, which can help you put together that small group learning. It needs to have a minimum of 2 GPs and a maximum of 12 GPs, but also it can be multidisciplinary. So it can have practice nurses, allied health professionals, and practice staff involved in that, but it does need to have a minimum of 2 GPs. In order to get the points in that 6-hour minimum, obviously you don't have to have 6-hour meetings, but if you're running regular meetings, in order to claim the points, each individual GP would need to attend at least, if it was a 2-hour meeting, at least 3 of those to have that minimum of 6 hours. That's not to say they can't go to lots of other of those meetings, but in order to get the 40 Category 1 points, you would need to attend at least 6 hours worth of those meetings. And there needs to be that documentation within. So it's a really great way as a group to work together and also obtain those Category 1 points as well. The second activity that we'll just go through is clinical audits. Again, this is a Category 1 QI activity. A clinical audit is when it's a planned medical education activity and it's designed to help you systematically review clinical performance against best practice guidelines. Now, these clinical audits can actually be set up as individual audits or as a group audit. So we're talking today about how you can do things as a group, so we'll talk about the group audit. It reviews aspects of a GP's clinical performance, as I said, against best practice guidelines. So that can be done as a group and against a particular topic or a particular theme. It can be undertaken by GP, as we said. It can be of a fixed time duration or it can be based on a number of patients. So it can be, well, how many of these types of patients come in within a month, or it could be specific patients identified with a particular condition. There's 2 main components of a clinical audit: the evaluation of care and the quality improvement process. At the end of this section, I'll just go through where you find the templates and where this information comes from for you. The last one we'll go through is that Plan, Do, Study, Act, which is different to a clinical audit in that there's a cycle to the process. It's implemented as a planned program and it's about systemic changes in general practice. So this is a great one to do within a general practice. It's Plan's improvement program that breaks down change into manageable portions, and it's about testing, monitoring, and what is the effect of using using measurement tools, and it's a minimum of 2 cycles. That's not to say you can't do more cycles, but it does need to have the minimum of 2 cycles. And again, it can be undertaken by an individual GP, a group of GPs, or even again that multidisciplinary team, so that your GP practice is all working together. And lastly, the other requirement is CPR, obviously. It's always good practice to run CPR events regularly, and often they can be done within the whole practice that the team is all part of that. And it's really, again, good best practice to keep a register of who's done CPR so that you know who's coming up for review and who needs to do that, and that everyone within the practice is up to date on their basic CPR skills. Where you find the information about these different types of activities, again, is through the website. They are specifically in the My CPD section on the right-hand side that is highlighted in red. You then would go to submit a self-directed activity. And this is where all the information and where you go to update all of this information is. Within that self-directed activity, there is section, there is templates. These templates can be either in a PDF form. That form is a template that can be then sent through to RACGP to be uploaded. Obviously the preferred method and the simplest one for you often is to do it online. These online forms can be saved as a draft or they can be finalised. Once they're finalised, the points for that activity come straight through to RACGP and onto your statement. They come through to us from a QI&CPD point of view if you're adding a specific interest in there, if you're adding CPR in there, if you're adding a grant in there, and then there's a further adjudication process. But otherwise, the points get put straight through onto your statement, so they're easy for you to see. In order to find activities that are in draft, including plan, this is the place that you would go, and you would see a list of activities at the top that you had in draft format. There is also some additional resources on the website that you'll be able to find. And these are the ones that are specific to GPs. As you can see, there's a quick guide to developing a clinical audit, a Plan, Do, Study, Act, also a small group learning. There's also GP research and active learning module in there as well for your information. So there's a lot of information there if you would like to do a bit more reading or find some templates to make it easier for you to do these activities. Just to touch on credit point statement, because it is always good to know how many points you have and what those points have come through from. Often those points are also needed for your practice accreditation, so this is where you would go for that. Where you would go again is the My RACGP, which is the highlighted one up on the top in the red, and then on the left-hand side you'll see My QI&CPD statement. So we're going to click on that button, and when you do that you come through to the next section. You're wanting to put in, if you haven't already logged into the website, you want to put in your RACGP number. You can print the statement, you can print it to a PDF, but this page will give you your total points for CPR, QI activities, and your Category 1 points as well. And it does go into detail if you scroll down into all the different types of activities and points that you've done, what their name is, how many points, and where they were done. So it provides all that information for you. How can we assist? So the college office here in Western Australia, we've got 2 people here in the QI&CPD team. So as well as resources on the website, as we've just gone through, we're here to help you. You can give us a call, you can email, and we can assist you. As we discussed, there's frequently answered questions and plan guide online. What we can also do, if you'd like some more information about plan directly to your practice, we can come out to your practice and do a face-to-face accredited Cat 2 talk on plan, an info session, or we potentially could even do it on a teleconference if you've got specific questions that you would like to ask in that format. If you're coming into West Leederville, or you've got a trip planned, or you're working in the area, we have allocated times and days on site here in the college office where we have computers available and we have staff on site to assist if you'd like us to help you with plan. And what we'll be starting to do probably from July is add additional plan information to our education activities. So if you booked into an education activity and there's a plan session happening either before or after, we will let you know. So we can help in all those different ways. Just having a question coming through. I'm just going to see what that is and I'll answer it just at the end. So just bear with me. If you can just bear with me. So they're all the different ways that we can assist. So my name's Sharon and Linda's here as well, so we'll be able to assist you with any questions that you have. So please send them through. All right, so one of the questions is, could plan be used in those instances where a doctor has a supervisor or mentor, i.e. send a peer review email to their supervisor? So that question is perfect. So I would say the ideal scenario for plan, especially that peer review, is for that purpose. So if that doctor that has a supervisor or mentor would like them to look at it, that is the ideal way to do that. So is there any other questions coming through?
Oh, Sharon, it's Sonia. I thought I'd come in here personally. I was quite interested to see that there was a quick guide to a clinical audit on one of your slides.
Yes.
And I'm often getting asked, what should we be auditing? Can practice managers just access that, or is it just the GPs that can go into that section?
Often those quick reference guides are in the area where you need the GP login to do that.
Sure.
GP could access it for them, but we could also provide some, if a practice would like that information, we're more than happy to pass that out send it out to practices. So if you'd like some quick guides or copies of templates, we can absolutely send them out to you.
Yeah, I think that would be really useful. Well, I've certainly found it very informative, and it's sort of opened my eyes to what goes on there in the background, because I wasn't really 100% sure. So thanks for clarifying that for us, Sharon. Yes, very, very useful indeed. Thank you so much.
My pleasure. And if anyone has any questions, please don't hesitate to contact us at RACGP WA, or otherwise Rural Health West has all of our details and we'll be able to put you through to the right person.
Absolutely. Yep. Send anything through to me. Thank you so much, Sharon.